Okay. Hello, everyone. Good morning, good afternoon, good evening, depending on where you are. We thank you for participating in this webinar. On behalf of the ARNEC Secretariat, I would like to welcome you to this webinar, which is actually an introduction of the IDELA Data Explorer developed by one of our partners, Save the Children USA. IDELA stands for International Development and Early Learning Assessment, which is a measurement tool for early childhood development. I'm Evelyn Santiago, and I'm the Executive Director of the ARNEC Secretariat. For some of you who are not yet familiar with ARNEC, we are a network for early childhood development in the region. We were established in February of 2008 with the core objective of building partnerships and advancing the ECD agenda in the Asia-Pacific region. Our main focus is on promoting holistic and inclusive early childhood development. We work with a lot of partners at the global, regional, and country levels as well. One of our strategic goals is to develop, co-create, consolidate, and disseminate early childhood resources and tools in the region to increase the knowledge base on ECD. Today's webinar is essentially supporting this objective of ARNEC, of sharing ECD tools which would be useful for the ECD community in the region. IDELA is developed by one of our strategic partners, as I've said, Save the Children, and they are now ready to share with us this very important tool, which is now, I think, being used in 72 countries, creating a wealth of global data on early childhood development. Data which would allow countries and organizations to have a better decisions on their investments about ECD and about ECD investments and interventions. Today's webinar will be moderated by Meenakshi Dogra, which is actually one of ARNEC national representatives for India. She's an early childhood education professional and has worked with UNICEF India and UNICEF Pacific. I think Meenakshi is now actually working with for UNICEF India. She's also a freelance expert and has been conducting process documentation, baseline evaluation, and training, on organizations on early childhood education. Meenakshi, thank you once again for agreeing to moderate this very important webinar, and over to you.
Thank you so much, Evelyn, for the introduction and for providing the brief background about the today's session. I'm really happy and thankful to ARNEC for organizing today's webinar on such an important topic of measuring ECD through using IDELA Data Explorer. So before we start our session, I would like to highlight some of the gentle reminders for you all. So like this webinar will be recorded, and all the resources will be shared, will be made available on the ARNEC's website afterwards. For asking question and answers, I request you all to please use the Zoom meeting control, the question and answer feature located in your Zoom meeting control to ask questions. And you can also upvote a question by clicking the thumbs up icon. Please join us as ARNEC member to be informed of the ECD happenings in the Asia Pacific region. You can go to our website arnec.net and sign up there. And please follow us on Facebook to get regular updates related to ECD. After this webinar, you will be directed to a survey. I request you all to please fill that survey and share your valuable inputs with us so that we can evaluate and make improvements based on your suggestions. So thank you so much for joining us today. So to start our today's session, we have two esteemed speakers with us who's going to talk about how IDELA works, how one can use IDELA Data Explorer to make evidence-based decisions in ECD. So I would like to introduce our first speaker, who's Freddie Nobel, who works for Save the Children US as the IDELA website and knowledge management specialist. Ms. Nobel has experience supporting fundraising and project management for nonprofit organizations in the US and internationally. Since joining Save the Children in 2014, she has focused on the knowledge management needs of education and child protection programming, including website and community development for the International Development and Early Learning Assessment Tool, which is IDELA. Ms. Nobel has grown IDELA partnerships and global reach by more than 30% since 2017 and helped to establish IDELA as a global good in the field of early childhood development. I welcome Ms. Nobel for the today's session. Now I would like to introduce our next speaker. Ms. Laila Chakaya is a senior specialist learning research at Save the Children USA, working mostly on early childhood education. She holds PhD in education sociology from European University Institute and MA in international education from Harvard Graduate School of Education. Laila has over a decade of experience conducting quantitative and qualitative research in education. Prior to Save the Children, she has worked with UNICEF and government agencies and universities. I welcome you, Laila, for the today's session. So now I would like to request Freddie to please start your presentation.
Wonderful. Thank you, Nakshi, for that wonderful introduction. It's great to be here today, and thank you to Evelyn and Andrea for organizing this session. We're grateful to have this opportunity to speak directly to the ARNEC community. Today, I'd like to talk to you briefly about what IDELA is and give you an introduction to the tool itself, and then to hand it over to my colleague, Laila Chakaya, for an introduction to the Data Explorer, which is our most recent resource development for IDELA. I am then going to come back and briefly speak about how our peers are using the Data Explorer and why this tool is so important as a development in the early childhood development community. And finally, we have ample time for questions and answers today, so we're very excited to hear from you and what your interests are and how we can, IDELA may be able to support your needs, your work, and your interests. To begin, the International Development and Early Learning Assessment is a holistic assessment that captures 4 domains of children's development. These domains tend to appear on most national early childhood development curricula or standards where they exist. And IDELA is an interactive assessment. It covers motor development, emergent literacy, emergent numeracy, and social emotional development. Within each of these domains, we ask children to complete tasks that are fairly play-based. So it may be hopping, coloring, drawing a picture, counting beans, short interactive activities that children tend to enjoy doing. IDELA is meant for a limited age range. We find that it works best with children ages 3.5 to 6 years old, although there have been cases where IDELA has been used for a range of 2 years old up to 7 or 8 years old, but those are more extreme circumstances. On average, completing the assessment of 24 different items takes about 30 minutes and is done one-on-one between an adult and a child. IDELA was developed to meet a unique need in the international community for a low-cost, global, adaptable assessment, and I'll get into depth into some of those points in just a moment. So, as I mentioned, IDELA is a direct child assessment. You may choose to survey caregivers in your research, but IDELA itself is done directly between an assessor and a child. Number two, it's intended for global use, so it's adaptable to a variety of contexts. As Evelyn mentioned, IDELA is in use in over 70 countries now, so we've proven that adaptation both at the country level and in different parts of each country. IDELA is important in that it tracks and monitors progress in child development on a population or community level. It's not looking just at the individual child or assessing an individual child, but is truly meant for a group of children. And finally, using the data from IDELA, you can track the impact of your intervention or compare the effectiveness of different approaches. We have seen IDELA used to improve policy, programs, and practice. So you may use it for your own individual programming needs and use the data to understand what works and what didn't. But we can also use this data to go up to the policy level to change what's happening on for children. But there's a few things that IDELA is not. Number one, it's not a high-stakes school readiness test. As I mentioned, it's meant to be used in a group and not for an individual child. So we would never assess a child using IDELA and then suggest that that child was or was not ready to move on to the next level or to grade 1. It's meant to be used in a group to look at how all the children are working as a whole. And as such, it's not an individual child diagnostic assessment. So we wouldn't use IDELA to say that this one child is struggling or particularly successful in certain areas. And IDELA is also not ready for any use off the shelf. There is an adaptation and translation process to make sure that it's ready to be used in your particular context. That said, we have a lot of resources to help you along the way. So that process can be sped up a little bit, and you would receive lots of support in it. Here are two pictures of individuals doing the IDELA assessment with young children. Both of these examples happen to be outdoors, which is very common, but the assessment can happen indoors as well. Of note here is that IDELA is very low cost. The materials needed to complete the assessment are fairly simple. A book, pencil, paper, objects for counting like beans or sticks, some picture cards, and printed materials. Adaptation and translation are built into this process of using IDELA. So the pictures that you offer the children as part of the assessment or the items that you ask them to count with are part of what can be adapted to make sure that the children are familiar and comfortable with the materials that they're using. Now, where we stand at present. Right now, IDELA has more than 105 international partners outside of Save the Children. These partners are using or have used IDELA in 73 different countries, and their use has resulted in 59 different language translations, which is fantastic for new users because they're often able to build upon a previously completed translation by a peer organization. On our website, idelanetwork.org, you can find a variety of resources that are always open to the public. These are listed in orange on the right-hand side. These include reports from people who have used IDELA in their program assessments, a variety of case studies showing how different partners have used the tool. There is the Data Explorer that's open to the public, and Layla will introduce you to that in depth in just a moment. And we also have a community of practice forum where people from the public can ask questions about how to administer IDELA and what the tool is. And those questions are answered by peer organizations or by Save the Children staff. And that becomes a huge repository of frequently asked questions. If you do choose to become an IDELA partner, which is absolutely free, partners sign a short agreement saying that in exchange for use of the tool, they will also share their data and reports with Save the Children. When you become an IDELA partner, you receive access to the IDELA administration guide, all of our translations and adaptations, training materials, including a schedule for training and sample PowerPoint slides, and guidance videos that we created about 2 years ago to help administration of the tool in a different format. These 105 partners come from a variety of different kinds of institutions. We have academic, university, large NGO, local community-based organizations, think tanks, consultancies, and research institutions, all using IDELA. Here are a few examples very briefly. ACER is using IDELA for a program evaluation of its Pathways to Peace program in the Philippines. World Vision is using IDELA in conjunction with their classroom observation tool, a great example of two tools combined to get a more holistic picture. And World Vision is using it in over 10 countries to measure preschool quality. New York University, in conjunction with International Rescue Committee, is using IDELA to measure impact in its education in emergencies programming, and also for the new MacArthur-funded work with Sesame Workshop in a number of Middle Eastern countries, which you may have heard about. And finally, Aga Khan Foundation is using IDELA for its Schools 2030 initiative, which is a 10-year, 10-country longitudinal research and learning improvement program. We have a variety of other partners, over 100, and many of those are profiled in case studies on our website. I'd be happy to share that link with the group afterwards to ensure that you understand the very different ways that IDELA can be used. I look forward to answering your questions after the session. So please, if you have any general questions about what IDELA is or how it can be used, I would be happy to answer those. But for now, I'm going to turn it over to my colleague Layla to give you a more in-depth look at our new tool, the Data Explorer.
Hello, everyone. Thank you, Franny, for such a detailed introduction of IDELA. As Franny said, I will now introduce our new tool, IDELA Data Explorer. As Franny said, we have a lot of data sets. So we work with a lot of partners and we get a lot of data from these partners. To organize this data and to present this data in a visually compelling way for our partners, we have built a platform, dynamic data visualization platform, which I'm going to present now. So first, how to access this platform. You can access it from main IDELA webpage. If you go to IDELA webpage, you will see that this pops up, or if this does not pop up for some reason, you can also go to IDELA Data, and then it takes you to IDELA Data Explorer. So the first initial view, as you see, is of a globe, a spinning globe, and then you can see we have data from a lot of countries, not all countries, but it's a slightly different color. For example, if you click here, it lists the data that we have from Brazil, for example. We have another way to explore data sets. Instead of map view, you can switch to list view. And then we have a bunch of filters here. So you can choose your data set by region, by country. You have a lot of countries. We will be adding data sets to the Data Explorer as the data comes in, by type of programs, and so on, by organization, by year of the study was conducted, by the sample size, and so on. So you can filter as you please. So now I want to demonstrate one example. Let's pick Bangladesh. So these are all the data sets that we have from Bangladesh. Let's pick this one, which is a randomized control study, baseline from a randomized control study of a Save the Children program that was conducted by American Institutes for Research. So we click and it takes us to the dataset webpage. So here we have brief information about the program and about the study. Which organization conducted, what is the sample, very brief description of the study, language, year, and so on. As we scroll down, we come to the to this you will notice that here we have child and caregiver section. So for now, we are in the child section. We will switch to caregiver section later. So we have here the main graph, which depicts average scores for this sample of 1,857 children in this study. So here, if you click any of these signs, you will get information of what this score is. And we can see, so average scores of children in this sample in motor development was 42.36%. So IDELA always ranges from 0 to 100. So average score of these children was, so these children got 42.36 correct out of 100. This is emergent literacy score, emergent numeracy score, social emotional development score, and then total IDELA score, which is the average of these 4 domains. So, so this is 4 domain and IDELA scores. You can filter the data as you please by different characteristics. So, for example, we have a lot of data sets employing some sort of experimental design, whether it's randomized or quasi-experimental. So for many data sets, we have intervention status. Let's try intervention status, and if we apply filters, it gives us the view of control group or comparison group and intervention group. As you can see, this is the baseline of the study. So as you would expect in a randomized control study, the scores are the same for intervention and no intervention group. In addition, you can filter by gender. Like if you click boys and apply filters again, now it shows you only data only for boys. We would have also this data set, for example, they were all the same age, but we would have typically also by age, by region, and so on. You can choose to export this data. You can choose to download as pictures or export as a CSV file, and then it would download as data. So just one thing, when you export, you have to make sure that the filters are applied as you want them to export. So for now, for example, if you click export, it would export for boys only by intervention, no intervention status. If you want the general data, then you would clear filters and you would export the data afterwards. As you scroll down, you can see, so we have 4 domains here. So as you scroll down, you can see separate charts for each of these domains. If you click expand, for example, here we have motor development. You get brief information about what motor development domain is, and you can see what items it contains. So motor development consists of 4 different items, and you have scores for each of these items separately. Again, you can filter as you want. Then you have emergent literacy, which has 6 items. This would mean, for example, that children scored 31.45% on average on expressive vocabulary task, which is one of the tasks, one of the 6 tasks of emergent literacy. We have 7 tasks in emergent numeracy and 5 tasks in social emotional development. Finally, on this page, on this section of the web page, we have additional information about the sample. So this is the distribution of IDELA scores. As you see, it's very close to normal distribution. And then we have distribution by gender. Roughly half are boys and half are girls, and in age in years. Here, because of the nature of the study, all the sample children were 4-year-olds, but as Freddie mentioned, mostly it's used for 3, 4, 5, 6-year-olds. If we scroll up, we can move to caregiver section. So this was all child-specific data. But we, together with IDELA Child Outcome Measurement Tool, we also have a caregiver information collection tool, which we and our partners very often use together with the main IDELA instrument to gather background information about socioeconomic status of the family, learning environment at home, and so on. That tool can be adapted according to context, but many items are consistent throughout the data set. So if you click here, this toggle, we are transported to caregiver section. So what caregiver section does is presents IDELA outcomes, child development and learning outcomes in conjunction with the background information. So one of the most important background variables that we have is home learning, possession of home learning materials. And we are always trying to explore how does having a good home learning environment, possessing a lot of home learning materials is associated with child outcomes. So here we have on x-axis, you can see we have a number of home learning materials. That means the number of different types of reading materials and toys that a family might possess. And on the y-axis, we have, in this case, we have standardized IDELA score. And as you can see, based on this line, there is a positive relationship. So on average, the more learning materials a family possesses, the higher is children's development and learning score. So it also includes a little bit of statistical information and analysis outcomes in here. So if you approach this line, you can see that it shows you how much of the variance in outcome is explained by the home learning materials, what is the statistical significance of the relationship, and how much is the slope. So here you would, and here is the description. So one additional type of home learning material in the household is associated with roughly 0.059 point increase on standardized IDELA score. So here, what you can do, so this is a total IDELA score, but you can also choose to present other scores here. You can switch on social emotional development, and then you will overlay this another layer with different color. You can choose to switch off IDELA, and then you will have only social emotional development. And as you see, the line changes. For example, for social emotional development, there is not such a strong association with of home learning materials with the outcomes. You can choose to have literacy. For literacy, the line is more, as you can see, is more tilted, so the relationship is stronger. What you can also do, but only for IDELA, not for domains, you can see a global average. Global average line represents all the data sets that are in our database. And then you can choose to filter this data also by gender and usually by age. But as I said, this particular data set has only 4-year-olds. So we do not have age filter here. So this was possession of home learning, different types of home learning materials. It would include books, different types of toys, storybooks, coloring books, and so on. Next graph is very similar, but it shows a relationship between home learning activities. It's meaning caregivers are asked, do you read to your child? Has somebody sang to a child or told a story to a child, and so on. So this represents relationship between that variable and again standardized IDELA score. So here you can also see that the relationship is positive, but maybe it's not as strong. You can again choose to include other other domains or exclude as you want, and filter. Again, you can export all data as both as a graph and as data points. Then we have also relationship between mother's education and child development. Just a point to note, not in some of the data sets can have all these variables, some do not. So some do not have at all caregiver questionnaire, caregiver data set. So it depends on what data sets allows us to include. So don't be surprised if you do not see one of these or none of these in one of the data sets. So then we also have relationship between mother's education and child development. As expected, mothers to have more education tend to have children who have higher scores on IDELA. Again, you can filter this. Typically, we would have another variable which is not included in this data set. That would be a relationship between attendance of some sort of ECD or preschool and child outcomes, but you can explore all the data sets and see it for yourself. Then you could compare by intervention. You can filter by gender or by age whenever it has a age filter, and so on. And finally, here at the end, you have additional resources. So if you remember, I mentioned in the beginning that this is the baseline study of this study. So here we have midline and endline from this study. So if you click, this would take you to the midline. And then, for example, as a matter of interest, you could compare. Remember, by intervention status, there was no difference between intervention and no intervention groups. If you click here, you can see that there is substantial difference, and intervention group is doing much better. So at midline, because it's a randomized control trial, so you can draw conclusions that probably whatever the intervention was effective. But not all the data sets included here are from studies that are experimental. Some are monitoring studies, some are experimental studies, some are randomized, some are quasi-experimental, and so on. So you can really choose to interpret based on the type of the study, based on the information that is given here. So this was briefly the tour of the Data Explorer, and I'll be happy to answer your questions about Data Explorer particularly, but also about any questions about the tool and about this data visualization platform later. I will now stop sharing my screen.
Thanks, Freddie and Lela, for such a wonderful presentation and sharing your valuable inputs. So I can see that we have received a couple of interesting questions for you both. So I'll ask those questions one by one, and if you both can respond to those questions. Okay, so the first question which we have received, a very common question, is about the contextualization of IDELA. So how one can adapt or contextualize IDELA to a specific country context. So what are the things one can keep in mind while adapting the tool to their particular country context? So can you give some insights on that?
Sure. Yeah, and Leila, please add if you have more detail. So the adaptation process takes place before assessment is done. So it's part of a team adapting the tool to their particular use. So for a few examples, we have seen that in one case, one of the tasks that we asked children to do is to look at a picture and of a young child, a little girl who's crying. And we asked the child, what is this child feeling right now, in the child in the picture? And we might hear from the child that the little girl is sad or that she's upset. But the picture of the young girl is different based on different countries. So we have seen in some Middle Eastern countries and Southeast Asia that they choose to use a picture of a little girl wearing a headscarf because that's what the children in that area are more comfortable and more used to seeing. In other cases, we've seen adaptation in terms of the materials. So for counting exercises, maybe in one area, the children have some small building blocks. In another area, maybe they use beans. In another area, maybe it's not appropriate to use food, and so they'll use small sticks that can be found in that area. So it can be about the materials, it can be about the pictures, and in some cases, we've had groups who also wanted to add in one or two questions about religious or moral, ethical education that the children are getting. And so we don't recommend adding new questions to the tool, but sometimes there's space to add one or two questions that are particular to that context.
Yeah, and if you go to IDELA webpage, there is actually adaptation guide also that you can take a look at.
Oh, great.
And in general, I know Freddie mentioned this, but I strongly recommend going to IDELA webpage because it really has a lot of resources in it on adaptation, on administration, on video guides, presentations, everything available for free. So it really would be very useful, just to emphasize one more time.
Yeah, I think those will be really helpful to, go through and understand more about the adaptation part of it. So like if you'll take the next question, so how one can use IDELA for tracking the child's progress and understanding that, understanding where the early intervention support is required for that particular child. So how one can use IDELA for the developmental screening purpose. So can you suggest that, can you also suggest on, what should be the frequency for using the tool for assessing the learning of children? So if you can, provide some insights on that also, so that would be really helpful. Yeah.
I can answer that. So first of all, IDELA is not designed to be a developmental screening tool. And it's not designed to assess developmental level of individual children. It is a population level measure, which means that you would assess a group of students, and then you could talk about the average, you could talk about the distribution, you could talk about strengths of the group in different domains. You can talk about the differences within the group, like how boys compare to girls, how intervention group compares to control group, how children coming from different regions compare to each other, how children of different family backgrounds compare to each other, but you do not use it to track developmental progress of a single individual child. So that is not the intended use of IDELA. As for the frequency of use, we have seen IDELA used on same children because we have seen IDELA used in longitudinal programs where children are assessed at the baseline of a program or an intervention, and then a few months afterwards, and then, or like 2 years later as well. So for example, this study that I presented, the example, it was the children, they were like 4-year-olds at the baseline, then they were a 5-year-old at the midline, and then 6-year-old at endline. So it was like every year, but it can be used every few months. And so when we are talking about the same group of children, but yes, we use it only at the group level and not to draw conclusions about any individual child.
Thank you for emphasizing that point, Leila. I think that's very, very important that we keep that in mind while using IDELA. So moving
And
on to the
just so,
next.
just I will just add to that. That's why, like Franny also mentioned in her presentation. So the main use would be like the most common use that we see is for these program evaluations, intervention effectiveness evaluation, or some sort of monitoring of the program and so on, but not individual evaluation.
Not individual. Yeah, definitely. Yeah. So now moving on to the next, question that which we have received is about how to, what is the process of entering the data? How one can use this data for understanding the trends and the participation level and the outcomes of children. So what is the process? If you can explain that a bit to us, yeah.
Process of you mean how the data is recorded and entered?
Yes.
Okay. Yeah, that's actually one of the most appealing features of IDELA, I think, because it's very easy to use and very easy to score, very easy to record, to enter the data, and very easy to calculate the scores, and very straightforward. Even though it is very strongly validated, it's still very easy to use, easy to score, and so on. So most of the questions, most of the items are scored as 0 or 1, yes or no, and then it's a very straightforward. Actually, if you go to IDELA a web page, there is an Excel sheet where you can directly enter the data, and it has already made input formulas that would calculate the scores automatically. But or you can choose to use a lot of our partners use some sort of software to collect it, like a Kobo form, for example, to collect data, and then you have data, and then we have also instructions of how to score once you have the data recorded. I don't know if that is the question, and if I should talk in more detail about the scoring, or.
I think the question was more about, how one can enter the data. I mean,
yeah.
yeah.
So,
yeah.
So yes, there is a ready Excel file with already scoring formulas inside. So that is very easy to use. Yeah, you can choose to use any other electronic collection tool.
That's yeah.
Sorry. We also have a webinar that we did about a year ago, I think, that is recorded and available publicly on the website. So it talks about electronic data collection. We even get into detail about what tablets your team might want to purchase, using a Kobo form. That level of detail is there.
Great. Thanks, Freddie and Leila. We have a few more questions for you to, answer so that we can get more about, more details about IDELA and its use. So there's one recent question on, what kind of adaptation on the procedure in the field one can do to assess the children with IDELA during pandemic, especially during pandemic. So can you suggest some, key highlights on that?
Go ahead, Leila.
We have been struggling with this because, as you know, it's a direct child assessment tool, and like the whole value of this tool is that it is direct child assessment. So obviously, with the pandemic, it is wherever it's not possible to do face-to-face observation, then we cannot basically use IDELA. We have been talking about doing some sort of adaptation to do over the phone, but that would be asking caregiver, or there have been ideas of doing some sort of video calls, but we have not we don't have any adaptation that could be used remotely so far, but we are exploring options. But yeah, so far we do not have anything for that.
Okay. Yeah. So, like, as you mentioned that, like one can use the data to understand, the population level status and all. So if you can, tell us more about how we can use data to inform policy or advocate for policy development and changes at the country level.
Sure. I'll start this one. We created the Data Explorer itself because we believe that the data the learning that we are getting from all these partners using IDELA should be available to the global community. IDELA is meant to be a global good for early childhood development. And so part of our relationship with these partners is that if they use our tool, they share their data with us. And we want to make sure that that data is available because it's not, it can be used in so many ways to advance policy and to advance programming. So the Data Explorer is really that offering. It's available to the public at any time. When working to advance policy, we have found that the data from IDELA and the visualizations from IDELA can be really useful in sharing key pieces of information with different policymakers at different levels. So because they can understand the tool relatively easily, and then they can then understand what the results are, it gives them better insight into the trends that are happening in their own countries. We've seen wonderful examples of this in Rwanda and in Bhutan, and I believe in Bangladesh. We might have some colleagues on the line who could speak to that. But so these smaller studies that are using IDELA can then take that information up to a much larger level to affect change on a greater level. And when I say trends, I could say differences that we're seeing between scores in girls and boys. Why is there a gender gap that might be happening? Why are children from certain regions or certain backgrounds scoring higher or lower, and what can be done at the ECD level to remedy that? So it feels very small. You're assessing with a child one-on-one, but that data, when surveyed from many, many children, can really be taken up to much higher levels to affect change for more children. But I'm going to turn it over to Leila because I think she has seen this process more in depth than I have.
Yeah, I just wanted to say this example, actually the data that I showed, I see that Zanat from Bangladesh was attending, but I think maybe left already. Hello, Zanat. Anyway, it's nice to see you here. But this particular study that I showed the data from, it was like a randomized control trial to see how one additional year of preschool education could be effective or not for children's development. And then it showed really great results. It showed that if children get one additional year of preschool, they show much better results. And I believe the government of Bangladesh is taking up this initiative to expand their preschool offering. And there are these developments in this respect based on this study. So that would be one example of such an use of IDELA data to inform policy decisions.
We have a number of case studies on the website that tell a short story of how this process was done. And we're also going to be releasing a much more in-depth package over the next year as to how to use data. What do you do with all this data that you're collecting? And to tell more stories of how people have used it. So there's some on the website and there's more coming.
Interesting. Yeah. So I think that explanation is very, very helpful for, understanding that how we can use data for advocacy purpose. So now we would like to, ask some of our participants to directly ask those questions to you. So I would like to call Manzoor Khalid for asking his questions. I could see that he has raised one very important question. So Manzoor, please ask your question.
Hello.
Hello, Manzoor. Please ask your question.
Can you hear me?
Yes, we can hear you.
Okay. My question was, is there any possibility to identify individual learners' progress? Because in presentation, I have seen that it is group to group assessment or progress monitoring. This is one thing. Can we use IDELA data for advocacy purpose with government in Bangladesh? This is another question. As reference data, because this is secondary data. So can we use this data for our? Is there any permission required for this purpose?
I will answer the first one, and then maybe Freddie can talk about the permission.
Sure.
As we said, so IDELA is not an individual developmental progress monitoring tool, so you would not use it for monitoring individual children or how they develop. So yeah, you would only use it for group level. I mean, you can use it to monitor development of your child at home. I do with my son, for example. It's not officially, formally, it cannot be used as to monitor developmental progress of individual children.
Okay. Thank you.
As for sharing the data, the Data Explorer, what Layla walked you through today, is open to the public. You can all go on the website after the webinar. I don't want to take you away, but it's open to the public, and you can choose which countries' data you want to look at and visualize. If you're interested, so those graphs and those statements can be brought for advocacy if you're interested in doing that. If you're interested in looking at the Excel level individual child scores, like the original data that was collected, that we don't share publicly because data is so protected and it is child data. And you can email us at Save the Children. I will provide the email to Nakshi to share to the group. We can connect you with the partner that collected the data, and it's their choice if they want to share it with you, but we're happy to facilitate that connection. We sometimes have individuals from research institutions or large universities who want to use the data for a research project, and we can facilitate your access to it, but it is the partner's data, so we don't share it directly.
Okay. So,
but if you collect the data yourself, then of course you are free to use it as you want with the government or wherever you want. There is no additional permission needed for that, like if it's your data.
Okay. Thank you very much.
Thanks, Manzoor, for asking your question. Now I will ask Arnold from Save the Children Indonesia to ask his questions.
Good afternoon from Indonesia. Can you hear my voice?
Yes, we can.
Hello.
Yes, we can hear you.
Yeah, I'm sorry, I'm not working for Save the Children anymore, but before that I worked for Save the Children, and one of the representatives for IDELA before the school readiness assessment, ELM and IDELA, of course, with Evelyn Borisova. Yeah. So maybe I know Freddie too. I email from Child Fund to use for our baseline and endline assessment.
Yes.
IDELA. So now I'm working for Tanoto Foundation. My question is, we used to take a look at the draft, for children with additional needs. Yeah, but I take a look at the website, the Data Explorer. I didn't uh, find any of the IDELA for the children with special needs. So the first thing, and the second one, I want to ask about, can we use, is there possibilities that we can use early literacy and math as intervention beside IDELA? So that's all.
Could you repeat the second question, please?
The second question is, the IDELA have the ELM, early literacy and math. It's for to support the intervention. So when you get the results from the IDELA, you can use to improve the literacy and math for the early childhood. So is there any possibilities that we can use ELM beside the IDELA? Okay, that's all.
Okay. Leila, I'm going to have you, I think, take these.
So the first question about the disability. So, so we, as I mentioned, the background questionnaire that we have for caregivers, where we ask about their status, caregivers, or like family status, education, and so on. And there, sometimes we also have questions. It's not we, it's really the partners, whoever uses, they choose what questions to include and what to exclude. And some partners ask questions about the disabilities, like whether a child has a disability and what kind of disability. And some data sets do include that data. Maybe those data sets are not yet uploaded on the Data Explorer, because Data Explorer is like very relatively new tool, so we do not have all the data sets in there yet. But that said, I believe there are not so many data sets that would have that kind of information, whether a child has a disability or not. But probably if you check back in after some time, there could be a couple data sets that would include that information. As for ELM, I mean, of course, ELM can be used without IDELA. I mean, IDELA is mostly, for those who don't know, ELM is a package for early learning that Save the Children has developed and typically uses for children 3 to 6. And like we in Save the Children programming, these two accompany each other somehow. We implement ELM package, and then we have IDELA to measure how effective this was and how did it help children and so on. But if you want to use ELM and not use IDELA, or the other way around, yes, it's totally fine. But I mean, for ELM, there is separate procedure. Like if you want to use the ELM package, that's an entirely different procedure where you have to contact the ECD team, and then there is a separate memorandum to sign. But in principle, they can both be used separately or with other programs and other assessment tools. Yes.
Okay, thank you.
Sure.
I will just add that we want to encourage people to use IDELA for children where disabilities are present, but there's not one set IDELA tool for disabilities because the disabilities can be so different. So in our administration guide, we give a lot of ideas for how to accommodate different disabilities, but there's not one set tool that would work in all cases.
Okay, sorry. I remember in 2015 that they Save the Children drafted the IDELA for children with special needs. So that's why I'm asking you that question. Yeah, thank you.
Yeah, I will go back and see what version of that was. Maybe that's an adaptation that we could continue
Yeah.
to build on. I would love to check
Okay.
on that. Thank you.
Thank you.
Okay, thanks Arnold for asking your question, and thanks Freddie and Ella for responding to his question. We have one more question, last question from our participants. So I would like to call Mazrika to for asking her question. Mazrika, can you hear us?
Okay. Hi. Yeah, my name is Mesrika. I'm from Indonesia, Food for the Hungry Indonesia. So yes, I think I'm still new with this assessment because before I had experience just doing CLA, but I think it's different. So my question is how IDELA can monitor or track progress on population or community level, and the second is, does IDELA prepare like program recommendation after we finish IDELA assessment? Yeah, thank you.
Very nice to meet you, Ms. Rika. We have a very close working partnership with Food for the Hungry in many different countries, and Food for the Hungry uses IDELA a lot in their assessments all over the world. So yeah, it's good to see you here. So how it can be used? Yeah, first of all, yes, as I mentioned before, it is designed to monitor developmental progress at community or population level. So that is a very appropriate use of the tool. And basically, in most cases, what you do, for example, if you want to monitor the progress of the same group of children or different groups of children at in some region or in one context, you basically, what you do is you compare IDELA scores as time goes, for example, if that is your question. Now in this data set that I demonstrated, you see that, I don't know, I think the average score of all the children at baseline was 40 or something. Then at the midline, the score was 60. So you can see how scores increase over time and whether they increase similarly for everyone, or whether there are some groups that that develop faster, or whether there are some areas where progress happens more, for example, in emergent numeracy, but not in social emotional development, for example, depending on your context, on what you're interested in. So that is the, and then we use a variety of statistical analysis tools to somehow distill the effect of the program, if that is what we want, or distill the effect of living in different kind of environments, and so on. Does that answer the question?
Yeah.
Yeah, and the second question was,
does IDELA recommend the program or project after we done with the IDELA?
Yeah, we usually, like, if you go to our webpage, and we have a lot of reports from our studies, there is always a recommendation section with very actionable recommendations in most cases included, because IDELA is very straightforward. You saw, for example, if you go to emergent numeracy, there are 6 tasks, right? For example, one task is letter identification. You can, because you can zoom into each of the tasks, you can also see where are the strengths and where are the weaknesses. For example, you can see that children score particularly low on letter identification. Then maybe you can, I don't know, you can recommend to focus on that area, or strengthen that particular component of your package or program. Or you can see that children score okay on emergent literacy, but on numeracy they score lower, and then you can, the recommendation would be to focus more on numeracy, or for example, if one region scores lower than the other region, you can recommend to do maybe a further research into why exactly this region is falling behind the others. Maybe, I don't know, recommendation could be to improve particular area of programming, or maybe do an additional qualitative or quantitative research of what might be happening in one region, yeah, all sorts of programmatic as well as policy recommendations that can emerge from the outcomes of IDELA studies.
Okay, thank you, Ella.
Yeah.
Thanks, Mazrika, for asking your question. So I think now we would like to, close this session. And thank you, Lela and Frenny, for sharing your in-depth insights on how, we can use IDELA, especially for collecting, especially for the better, evidence-based decision making on ECD. So thank you so much for sharing your valuable inputs with us today. Now I would like to hand it over to Evelyn for the closing. Yes.
Thank you, Meenakshi. So we have seen really a very strong, high interest on the part of the members of the ARNEC, community in terms of using IDELA, and we're happy that we're able to provide this platform at least for introducing the tool. There's still a lot of questions, Leila and Franny, and I think what we will do is to still generate those questions, and if you don't mind, we can give it, we can send it to you so that you can also provide some responses to those questions. And again, I think it would be good for our participants to really visit the IDELA website for more information and resources, how you can use it, some of the case studies. It looks like, a wealth of information, and data are really in the IDELA website. So for now, I would like to thank once again Leila and Franny for spending more than an hour with us, today to introduce the IDELA Explorer, and we look forward to getting more, information as you, populate, the website with further information and data, and we'll send to you some of the questions. So thank you to our SAVE presenters, and thank you, Meenakshi, for moderating, and thank you to all our participants who really stayed on to listen and to ask their questions. Thank you so much, everyone. Bye-bye.
Thank you, Evelyn.
Bye.
Bye.
Thank you very much.
Thank you.